Hi, Governor colleagues. This is Sheila. I'm the Chief Nurse, Deputy Chief Exec and Director of People here at YDH. I've obviously met many of you, but I hope you're all safe and sound. And I wanted to give you a bit of an update of what's going on at the hospital, and I thought a video update might be quite a nice way to do that. So the hospital has obviously been through a lot of change in the last few weeks. We've done some structural change, which has included increasing the footprint of our emergency department. So the orthopaedic outpatients department has been temporarily moved to give us the ability to have a hot and a cold entrance really to the emergency department, so that you're treating patients who are either confirmed or highly suspicious of having COVID or coronavirus in the hot side, and that you're keeping the patients that are unlikely to have it in the cold side, so that you're keeping them safe. We haven't had to use that to its full extent. We did trial it over the Easter break, just really to trial the environment and make sure that should we require it in any type of surge, that we're ready to use it. But that was a mammoth task, changing the orthopaedic outpatients unit into an ED, and the teams pulled fantastically together to do that in a very, very short space of time. The rest of the hospital has undergone quite a lot of change as well. So we have our outpatients department is primarily and predominantly running remotely. So patients are having telephone and video consultation if they possibly can. So the only appointments that take place face to face are those that are absolutely necessary and where physical examination or a physical treatment is required. As I say, everything else is being done by telephone or virtually, which has actually gone down very well with patients, and makes sure that we don't have patients DNAing or do not attending appointments because they're frightened to come to the hospital. We have closed our main theatre. You will have seen on the news, etc., that hospitals were asked to stand down their elective operating, so that's anything non-urgent, really to enable you to train staff that work in the operating theatre normally, who are highly skilled staff, to be able to work in the intensive care unit. So we have closed our main theatre, and we are also able to open that as an area if we require it to expand our ITU capacity. Our ITU capacity has the ability in the ITU department to expand to 19 beds. So we've been working on models to make sure that we can do that safely by training staff and having the adequate equipment in place. And then should we require it, we could expand further. The Kingston wing became our COVID ward. So that's where people who are tested and found to be positive are nursed in the Kingston wing. The advantage of that is that the Kingston wing has all single side rooms with washrooms in them, and the Kingston wing team have done an absolutely amazing job, because obviously their normal day job is looking after pretty well patients who are having orthopaedic surgery. So they've probably as a ward, they were the first ward that was really locked down when all of this started to, when it all became clear what we were going to have to deal with. And 9A has taken patients who have non-invasive ventilation. So that's patients, you will have seen them on the news, who have a mask that's a bit more than just the normal oxygen delivery. And so those patients are being nursed on 9A, which is our respiratory ward. And patients who are waiting, they've come in and had a swab and they're waiting to see whether that is positive or negative, are being treated on our emergency assessment unit. Some structural changes within the hospital. Staff changes, we've obviously had to look at how we socially distance within the hospital to make sure that we're not putting staff at unnecessary risk. So we have a social distancing policy and a home working policy. So the first thing that we looked at was obviously all of our staff who have high risk medical conditions. And they have been isolated, and we've been able to furnish them with work to do at home if they've been able to do that. We've set up a central HR line, really, so that we could really get on top of very quickly people either phoning in sick because they had symptoms, or phoning in because family members had symptoms. And our absence rate of purely those people isolating for those reasons has been at about 4 to 5%. We have another percentage on top, which is about 3.5% of people who are deemed to have a medical condition that requires them to shield or stay in isolation at home for 3 months. And that's been very successful, and the team in that department have done an absolutely sterling job. And obviously now we're in a position where we can swab people to try and people or their family members to try and get them back to work quickly. We have to swab people within 3 to 5 days of them having symptoms, so that makes it a bit tricky, but we are swabbing staff on a daily basis. And we've had no areas that I would call hot areas where we've had numbers of members of staff who have come back as positive, and as far as I'm aware to date, certainly to YDH, we've had no staff admitted, which is good. PPE you'll have heard about on the news, so that's the personal protective equipment. We've been in a pretty good position. It's hard work, but we have remained in a good position, and we feel assured, and our staff are telling us that they're assured that we're protecting them appropriately, and that's really important. The hospital itself actually is pretty quiet. So the Southwest has had a very different picture to the rest of the country, with admissions and cases going into ICU. So we've been in an interesting position where actually we've only been using about 50% of our beds. So we've taken some advantage of that by making sure that we're staffing areas well, and that people have been able to take some holiday and some time off, which is obviously still important. And ICU is coping incredibly well. So all of our areas are coping very well. Our ED department is coping very well, has had a very much a reduced amount of patients coming through it, but they can be complex patients, obviously. So that has enabled everybody to take probably a more calm approach to making sure that we are ready, and that everything is in place as it's required. I think as I say, our staff have been magnificent. The amount of change they've put in place in a really short time has been extraordinary. And many of us will be questioning whether we need to go back to doing all of the things we used to do in the same way we used to do them. So we're already, in true YDH style, thinking about not only a recovery plan from all of this, but also how we can make things so much better in the future. We've been absolutely blown away by the amount of local support the hospital has had. So we have had donations of all sorts of things. There really is an outpouring of love for the staff in the NHS, and we've seen that at YDH. So we have had literally thousands of Easter eggs, and all sorts of donations really for staff health and wellbeing, which has been absolutely fantastic and continues. Every day we get another surprising donation, and our staff are so grateful for that. And also we are having obviously money that's being donated the same as it is around the rest of the country for really the health and well-being of staff. So we're very grateful for that. Fabulous letters from people. Fabulous news story last night on the news from a patient who we treated in ICU and went home. and was looked after very well, and did a fabulous piece on the news. So that really has brightened the day of the staff. The other thing that we've been doing as well is to work with the independent sector. So we have some beds at Shepton Mallet Treatment Centre, which are ours to use. And we've been using those for patients who require a little bit of a longer stay in hospital and a little bit more rehabilitation, but aren't COVID patients. We're working with Circle Bath to enable us to do some cancer operating and some other operating out of there. But we do still continue to do all of the urgent operations that we require here, and the urgent treatments that we require, and it's very important that we continue to do those. Generally referrals are down, and that is a worry, because the high likelihood is that people don't really want to come up to hospital at the moment, and they're not going to their GPs either. So we're mindful that there'll probably be a very big catch up after all of this. And we certainly need to make sure that people know they can still come into the hospital if they are sick. The hospital doors are not closed, they're just slightly more difficult to get through, to be honest with you. From a health and wellbeing point of view for our staff, we've put psychology support in place, lots of internal support from us as leaders. We're now, as an exec team, doing a 7-day working week, where there is a director in every day who is in our control room, which has now been running for probably over a month, I think, which is where we centralise all of the activities that take place in the hospital. But great to see all of the teams stretch over 7 days, and all of the leaders of the trust doing that so willingly, and enjoying it, actually. So that's been fantastic, whilst we're also enabling people, as many people as they possibly can, to work from home as well, so that we can socially distance in areas like the offices, because the offices really are very close together. We've had to close the canteen because the canteen was kind of the last remaining restaurant in Yeovil, and people were sitting too close together. But we've enabled rest areas on the wards. We're providing food to the areas where staff can't easily get out of. And as I say, our donations of food keep pouring in, which is fantastic. We're also doing quite a lot to support the Nightingale Hospital in Bristol. So Melitza is, many of you will know, is the health and wellbeing lead, currently working at the Nightingale to help to get that set up. We're also providing staff to do some of their training for them, and we've asked for some volunteers of staff who might want to go and work there when it opens. So very supportive of that, and that really, the whole Nightingale hospital piece requires support from all of the surrounding trusts as well. So things are, in this strange world in which we exist now, things are positive at YDH. We're all working hard. It's a bit of an odd bubble when you come into YDH, because we're all at work. And although the hospital feels much emptier, and we all have to walk 2 metres apart from each other, and we don't ever sit in rooms and have meetings anymore, very much it feels a bit business as usual. But we are all working hard to support each other and to keep our patients and our staff and our community safe. I hope that's been a really helpful summary. I'm quite happy to do something again in the future. But I just wanted to give you a flavour for how things are at YDH. We miss all of you. We hope you're keeping safe. We know your thoughts will be with us. And stay safe and take care.